Hello and welcome. My name is Elizabeth Atkinson. The mission of the RHI is to engage partners to share ideas and expertise and to support communities in improving health while stimulating a higher level of wellness across the state. Thank you all for joining us today for our webinar. Why don't you have a Montana medical care savings account? The presenter today is Marsha Goetting, sorry. She is the Extension Family Economics Specialist and author of 44 guides on estate planning and financial management.
Uh, I'm really delighted to have you participate today in a topic that is kind of near and dear to my heart because it's a really neat program that the state of Montana has provided for all of us to be able to use. And what I discover is there's just a lot of folks out there that don't know about it. Okay, so you found out kind of who I am. I am an Extension Family Economics Specialist, and I happen to be with the Department of Agricultural Economics and Economics here at Montana State University. And I'm going to take a little bit different approach today with the program because I'm sure if you're like me, maybe you've attended a whole lot of webinars during the last 2.5 months. And I found sometimes if I'm not careful, I go to sleep because they're just not jazzy. And I'm going to try to make this jazzy in a different way. So I'm going to say we want you to ask questions as we go along, and we'll try to answer those. And then I plan to quit early enough so that you will know that we'll have time to answer those at the end if necessary as well. But before we get started, I'd like to get an idea. What we've got here is a poll, and I'm simply asking you, do you have a Montana medical care savings account? I'm not talking about the federal health care savings account. I'm talking about the Montana version. So this is a very simple one where you can click on yes or click on no, but don't forget to hit submit. That's at the bottom of the page there so that we can see what the answers are. And it'll help me as an instructor know more about how I should address our community here. Okay, Elizabeth, we've given everybody 30 seconds. Let's take a look. So as I look at the responses, I'm finding that only 3 out of 13 of you have an MSA right now, so that's why you're attending this session. We've got 7 that don't because, okay, you want to know, and we've got a few without an answer. So delighted to have you here, and let's just really get started with some of the subject matter. Now, the thing that concerns me is that in Montana, there are only about 1.2% that take advantage of this law. And I look at it and I say, why? Why aren't more people taking advantage of it when you have medical expenses anyway? So I hope by the end of this session, you are convinced that you need to have one. And those of you that already have one will get some additional information. Now, one of the things I'm trying to do to jazz up the program is use what I call an audience enhancement tool. The polls are one, my flowers are the other. And as you can see, maybe in the background, I happen to be a wildflower nut. And my husband and I were on our way home to visit my parents. And I'm saying, you know, my presentations sometimes seems like they're so boring. I wonder what I could do to jazz them up. And he suggested I not tell jokes because I don't tell jokes very well. But then I was working with my cards and my flowers, and I thought, I bet I could use wildflowers to tell a story. So I'm going to try it with you guys and see what you think. So these flower names will be a trigger, and they're designed to help you remember some of the topics and rules about MSAs. And I have to make a disclaimer because people, when they see my cards or they see the wall things, they say, oh, you bring these into your studio to take the photographs. No wildflowers were picked, stomped on, or destroyed by me to make the photos that I'm using in this presentation. As a matter of fact, that gives you my Yellowstone studio there. What I do is put black velvet behind the flower so that you have a black background and you don't get all the other weeds and things that are in there. So my very first flower here is, if you look at it a little bit, I bet you'll know the name. And what it is a steer's head. Yep, Those grow in May, typically in Yellowstone National Park. So what I want to do is steer you towards Montana's incentive for paying your medical bills and getting a tax break at the same time. That doesn't often happen. So what we have here is a self-heal. Well, a self-heal is the flower that reminds me about MSAs. So basically, a Montana Medical Care Savings Account is one that you can use to reimburse yourself for eligible medical expenses. So you can use the account to make the payment directly, or you can reimburse yourself at the end of the year. Now, these are for things that your health insurance policy doesn't cover. It's also for any of you that have a flexible spending plan, and I've had one, but some years I use it all up before the end of the year. So that's where the Montana Medical Care Savings Account comes in handy. And if we look at the health care savings accounts, well, not all of us are eligible for those. First, you have to have a high deductible health insurance policy. And also, if you're age 65 or older, you can't have one. So that's where the MSA can be handy. Now, the maximum that you can put in your MSA is $4,000 for a single individual and $8,000 for a married couple. But you must have two separate policies, or not policies, but accounts. You can't have $8,000 for both of you. You got to separate those out. Now, where do you establish your MSA? It can be your bank, your credit union. You can even have mutual funds as your MSA, or if you're really brave, the brokerage firm. But we all know what happens with stocks going up and down. Now, let's take a look at one of my colleagues here. This is Emily Stanley, who happens to be in Fergus County. And let's say that what Emily does is place $4,000 in her MSA. But the only medical expenses she has this year add up to $3,942. So we're going to have a poll here and ask you, by how much does Emily get to reduce her income? Is it the amount that she spent on medical expenses, $3,942, or is it $4,000, or neither one of those is correct? So tell me by clicking on one of these, A, B, or C, and go ahead. Don't forget to hit submit. Okay, Emily, I think we've given people enough time, or Emily, I'm sorry, Elizabeth, what responses do we have from our participants? Okay, it looks like most of you are saying that it's the amount that she spent. And we've only got 23% that said the amount deposited. Okay, I am really glad I asked this question, because you see what the answer is the amount that you contribute. So the whole idea is you could put $4,000 in an MSA, and you don't even have to use it, and you still get to take $4,000 off your income. So what that is doing, it's not a deduction, but what it is a reduction of income for the state of Montana. So in this case, Emily gets to take a $4,000 reduction in her Montana income. Those unused funds will remain, in her case, she is $3,952 of expenses. So what she has left continues to earn interest. It rolls over to the next year, and she can use that amount in future years. So my reflection or summary from the self-heal is that you're allowed to contribute $4,000 in an MSA, and you get to reduce the amount by or your income by the amount that you contributed. Now here we have some Bane Berry flowers, and I've seen those on the trail that I jog on. And these are Bane Berry Berries that will appear later in the season. Well, have you heard this phrase? So-and-so is the bane of my existence? Well, with Montanans, maybe it's income taxes, not a person. So let's take a look at this. Income tax-wise at the federal level, you're not going to save anything. because the federal does not recognize the Montana MSA. But in Montana, by putting that $4,000 in, Emily is going to save some money in taxes. So that's our next poll. How much do you think that Emily is going to save by depositing a total of $4,000 in her MSA? Is she going to save $322, $276, $189, or only $97? So you have half a or 25% chance of being right on this question. So give a guess, even if you don't know, because I bet a lot of you are saying, how would we know that? Well, I'm going to show you. Stay tuned. Don't forget to hit that submit button. Okay, Elizabeth, what have we got in responses? How much money do people think that Emily would save? Okay, we're looking quickly at the results, and we've got 8% that said 322. We had 38% say 276, and we had 8% that said 97. So this is very good because I didn't fool you guys a bit. What happens here is we need to first of all look at what is Emily's Montana income tax bracket. So we go to the Department of Revenue, and what I'm showing you here are the tax rates for 2019 because they have not released the relates for 2020. But we can be pretty accurate with it anyway, because I sure hope my colleague there is earning more than $18,400 a year. So that tells us then that her rate of taxation in Montana for any amount above that is 6.9%. So if we take a look at this, those of you that marked 276, you were right. But let's say another colleague said, nah, I don't want to bother with an MSA, too much paperwork, don't want to do it. Well, that same person, if they had the $4,000 in a regular savings account, would earn $8. We know how much our institutions are paying in interest right now, and it's not very much. So it would be logical that you would want to put that $4,000 in an MSA because, hey, as we get older, we're going to have more medical expenses that won't be covered by insurance. So we would be able to save that $276 in taxes. So again, don't forget our married couple. If they have the two accounts, what we can say is they're going to save $552. Now that's real money. And it's neat to think that Montana is providing that when we have medical expenses anyway that doesn't pay us a lot to deduct. So let's take a look at that. Now, again, the earnings will stay in the account. And then they can be withdrawn for future medical expenses as well. So my reflection from the Bane Berry Berries is that you can save $276 by putting $4,000 in an MSA. Now here we have a golden prickly pear. Some people call it bronze, but I like golden because it makes me think of money. And you see, we can make annual gifts to individuals that we want to. Now, typically it's a family member. So I've got an idea for you. If you're wanting to help out your kids or your grandkids, you can give them up to $15,000 and they don't declare it as income. And then they can take that money and open an MSA. A married couple can do $30,000, which is even a better deal. But anyway, at one of my estate planning meetings, I had a grandma and she said, you know, I'm just not feeling good about my grandkids. I hate to leave them a lot of money and just have them blow it. So my suggestion was, since you have the ability to be able to give some money, why not test them? And so that's what she did. She gave $15,000 to her married adult granddaughter. So the granddaughter wrote Grandma a thank you note. Thank you, Grandma. I really appreciate the money. Here is what my husband and I did with that $15,000. They didn't go out and blow it. What they did is put $4,000 in an MSA for the wife, $4,000 in the husband's MSA, and then she put $5,000 in an individual retirement account. Now, this is not a Roth. What she did was a regular IRA, and then she put $2,000 in a first-time home buyer account. And Montana allows you to put in $3,000, but she ran out of money. So she said, Grandma, I really appreciate that $15,000. And then in the last paragraph, she's telling Grandma, Grandma, you're not going to believe this, but because of the way that I used those dollars that you gifted to us, we saved another $2,285 in taxes. Now, is that cool or what? And what do you think Grandma's going to do next year? Well, I bet you she'll give more money. Well, maybe not, but even if it's the same amount, what a great thing for Grandma to find out about that adult daughter or granddaughter. Now, she gave the same $15,000 to two nephews. Would you believe the two nephews did not even write a thank you note? So if you were Grandma, what would you do about those two grandsons that, or nephews, actually? I'm crisscrossing there because it's happened in two cases. So my reflection from the bronze prickly pear is that gifts do allow you to express your generosity if you want to while you're living, and it gives you a chance to see how that money is going to be utilized. Now here we have an explorer's gentian. This is one of my favorite flowers that comes out in August, and you have a chance to see it in a lot of our forest regions as well as Glacier National Park. Explorer's gentian. So what I want to do is explore with you what expenses are eligible. In other words, what Montana is saying is that anything that you could take as a deduction on your federal return, we will accept it in the state of Montana. So to get an idea of the expenses that are eligible, you could take a look at Publication 502 from the Internal Revenue Service. And there's just all kinds of things that count. Your prescription drugs count, insulin, of course, dental care, eyeglasses, crutches, hearing aids. All those kinds of things are eligible expenses for your Montana Medical Care Savings Account. Now, my friend here, Emily, she wants to know, hey, how about health insurance premiums and the cost of long-term care? You know, I think my folks would be interested in this. So we want to take a look. Sorry, Elizabeth, I need to change the slide before. I can't do this yet. Well, that's okay. Go ahead. Sorry. Go ahead and say yes or no. And don't forget to hit submit. And we'll take a look and answer the question to Emily. Okay, Elizabeth, what kind of answers do we have? Okay, so we've got 38% saying yes, we got 31 saying no, and then we've got some, you know, the group of the no answers. Okay, well, let's see what the expenses are. And I can tell Emily that yes, these are eligible. But if your goal is to save the most in taxes, you don't want to use them for your MSA. Now, this includes your Medicare B plans, not A, but B, and Medicare D. All of those could be used. So if you're in a financial situation, and as Emily said, Marsha, that makes about as much sense as mud, or it's clear as mud. This is the question I need to ask you. Do you itemize on your Montana return. That is the key. So you got to look at your tax returns or think about those. And you might be thinking, okay, I have my accountant do this for me. Well, you need to take a look at this because Montana has such a deal on your health insurance premiums that, well, you need to know about. Okay, so let's take a look here, Elizabeth, and let's see what responses we have. Aha. We have 5% or 5 people that do itemize, yay, and we have some that don't. So let's take a look at what the advantage would be. You see, Montana allows us 100% of these to be deductible if we itemize. And not only that, we've got some young folks out there that are actually buying long-term care insurance for their parents. They're making the premium payments. And so you can subtract those long-term care insurance premiums for yourself, your parents, and even your grandparents. Montana allows you to do this. And I wasn't paying any attention to that until I started itemizing on my and doing my taxes myself again. And I got, whoa, I've given this up for several years. So you see on Montana Form 2, you know, we're past our taxes. We put them away. We don't want to look at them. But by gum, if I was your accountant, I'd say, hey, we want to make sure that we do this because this will save you even more money. So it allows you to put your medical insurance or healthcare premiums, any long-term care insurance that you've got too. So if we put that on Form 2, we can see that this particular family already has $20,148 in deductions. Okay, that's a deduction. And if we then also take advantage of the MSA, we've got a total of $24,000 plus 148. So we got 24,148 in deductions. And if we used our MSA money for some of that, we'd only get $20,000 in deductions. So I calculated up the difference that this approach would take, and you would save another $276 by having the $4,000 paid for other things or not even use it. I know it doesn't seem to make sense, but it does. So take a look at that on your taxes for next year. So your eligible expenses can be found in IRS publication 502. And if you itemize for Montana, good. If you don't itemize, look at that again. You may not want to itemize everything else that's on there, like the charities and what have you, because those are only 2% and what have you. But it's worth doing it for the health insurance and long-term care insurance premiums. Now, these are penstements. And if you look at those penstements, they've got little eyes and they've got a tongue. And what I'm saying is I'm calling them the gasping penstements. Now, why would I call it that? Well, the neat thing about an MSA is that you can use those medical expenses for yourself, your spouse, your children, your grandchildren, and your parents. Used to be just the spouse and the kids, but there's all these people. And why I say the penstements are gasping is that they're doing the same thing that I did when I heard that the legislature has made these accounts now that you can use them for anyone. So if you have a friend that, you know, has cancer and they can't make all their medical bills and you want to be generous and have them use yours because you've been saving it up through these years, that's a blessing that you would be able to do that for those people. So that's really, really cool. MSA funds can be used for anyone that you want to. You just need to make sure that you are writing out the check to the healthcare provider, for example. Now, I have a lot of fun with this particular one because I made a card out of it and sent it to a friend who had cancer and was not doing real well. And what did I send her? A mountain death camas. I felt so bad. But she had a good sense of humor and wrote me that when they were grazing sheep in the Lima Mountains, they lost 7 of them to the death camas. So what the death camas makes me think about are some of the rules. Now, let's say that you have an MSA and you died during the year. Okay, your personal representative that's helping settle your estate will be able to use your MSA for those last medical expenses if you have them for up to a year. So that can be taken care of. But an MSA can also be a legacy. Yeah, that means you can pass the balance of your MSA by putting on a payable on death designation. You can say, I want this payable on death to my grandchild, to my spouse, to whoever you want. You could also leave it in a written will. Or if you're one of those 7 out of 10 out there that die without writing a will, then Montana law will pass it down to the priority people. And priority people first would be spouse, and then your lineal descendants for that. So there's the family legacy that you can have for spouse, children, your parents, and grandchildren. And see, the thing is, if you leave it to them with your will, the POD, or even without the will, it passes to them, they can put the money in their MSAs, and it's not taxable. We don't have an inheritance tax in Montana. It's not taxable income to them unless they don't do an MSA. And then, woo, they've got the amount taxed for the state of Montana. The other thing that you can do that the Montana legislature passed is we could even do a POD, payable on death, or a TOD to some of our nonprofits. So maybe you would like to leave it to Montana's Rural Health Initiative, hint, hint. How about the Montana 4-H Foundation, if you believe in that youth program? How about the Alzheimer's Association? Because they don't have to declare it as taxes. They can take the money and do good with it. So that's something we could do as well. So my reflection for the death camas is, take control. When you open up that MSA, put a POD and a TOD on there. The TOD is for the mutual funds, stocks, bonds, and those kind of things. That's the same thing as a POD, except the POD is for your financial accounts, as in checking, savings, certificate of deposit, and even United States savings bonds. The neat thing about the PODs, you avoid probate. And people like to do that because it does cost some money. And why not save money to your estate by using a POD, TOD? Okay? Forget-me-nots. Now, what have I forgotten? Oh, I know. I need to tell you some of the rules. Now, let's say in December, you break your leg. You've been up there skiing, you break your leg, and what the person that did the cast, they want a $20 down payment type thing. Well, you don't know how much your insurance is going to pay, but you go ahead and write the check or use your credit card for $20. Okay, that's great, but that $20 needs to be withdrawn by January the 15th. You can't piddle around and say, oh, I'll do it in March, because no, it's for what was paid last year. You need to make all those withdrawals. Now later, when the insurance bill comes and says, okay, we paid $600, you still owe $50, then you could withdraw the $50 in the next tax year. What about if you become incapacitated? Let's say, the future, maybe, I worry about getting Alzheimer's because my mom had it, my grandpa had it. Well, then what I've got is an agent, and I've got a power of attorney. So I'm giving that agent permission to withdraw the funds to help pay for nursing home care if I need that. Now, if I didn't have a POA, then we'd have to have a conservator appointed. And a conservator is the one that handles your financial affairs while you're alive. Okay? Another caution. When you're opening up your MSA, check and see if they require a minimum balance to get the interest or simply a minimum balance to call it the MSA. We've got a few institutions out there that want $1,000 minimum balance. Ooh. Also ask about fees. Most of them should have this on a sheet of paper to give you. And it may not say at the top MSA accounts. Some do, some don't, because it's really a regular savings account. So get those saving account rules. I had a colleague who was expecting, and therefore she had a lot of appointments with the doctor during a month. Well, she had 8 withdrawals, which exceeded that particular institution's rules, and so she had a fee, $2.50. Well, let's just avoid that kind of stuff. We've got better ways to spend that $2.50. So don't forget to pay attention to the rules for Montana medical care savings accounts. Now here we have a foxglove, and I've actually seen some of these in Washington as well as Glacier National Park. So what would a foxglove make me think of? I want you to outfox the law. Let's say that you are like one of the ladies at one of my presentations, and she said, honey, I don't got no $4,000 to put in an MSA. Can't you do something better for me than that? Aha. I said, try the parlay technique. Now, this is probably a generational thing, but I bet some of us older ones know what parlay means. So this is what this lady, another lady, told me that she did. She starts out January 1st making small deposits. So what she did is put in $200. Okay, February rolls around and she's got $200. I'm making this simple. She's got $200 worth of expenses. Okay, now what she does is immediately redeposit the $200. So look at that. What she has done is parlay $200 into $400 because you see she's deposited $400. So in her way of controlling is to continue to make withdrawals, make additional deposits, and she says, honey, I can put in $200 and parlay that if I go enough times into 4,000. And that way can work. It's not that you have to have $4,000, put that in, and every time you have a medical expense, pull it out. Okay? So she parlayed that into 4,000. Now, my next technique, I could call it the convenience technique, but this is the Marsha Goetting one. And what I do is track my medical expenses January through December. And what I do then is deposit the amount of the eligible expenses. And mine usually exceed 4,000. But anyway, I keep all those in a folder. I add them up and I know, okay, I can withdraw $4,000. The most you can withdraw, unless you've had a lot of extra expenses, is the 4,000. But you see, now I've got several built up. And if I would have laser eye surgery and it was $6,000, I could withdraw $6,000, even though I only put in 4. So I could withdraw from that. I make one withdrawal. I typically travel a lot in my job, but not recently. And so that way I don't have to worry about it while I'm on the road. And then January 1st, I could go dashing in there and put in that $4,000 if I want to, or I could still wait till the end of 2021 and withdraw it at that point. So parlaying and convenience is important. So be Foxy, parlay a lesser amount into the income reduction of 4,000 for your MSA. Now, I'd like to get an idea about your intentions for a Montana medical care savings account. Are you going to open one for 2020? Because you still have time. Are you going to deposit some money in one that you already have? Or let's see, it looks like I only gave you three choices there. Number 3 is you're not convinced an MSA is for you. And if you're one of those that are convinced it isn't, share with me why. Because this would give me some information when I'm redoing my mock guide. Maybe I'm just not being convincing enough, or I'm not emphasizing the taxes, or it sounds like it's just too much of a hassle to me. What is it that makes you think the MSA is not for you? So throw that in the chat room and I'd appreciate it. So we've got Elizabeth here and she's given us the results. So we've got about 19% of you that are going to open one. We've got a 19% that are going to deposit. And interestingly enough, we have some that are not convinced, but we still have 63% of you out there. And if you're one of those that didn't respond that way, if you can respond in the chat room, your opinion, that would be great, or additional questions that you have. So my observation from my lady slipper, yep, isn't that a cutie? And I wish I could say that one was mine, but my husband won that contest. We bring them home, put them on the computer, and whichever one's the best, we vote, and his won because mine wasn't as good. So time has slipped away. And if you don't have a memory like this elephant's head, yeah, you can laugh if you want to. I can't hear you, but I hope a couple of you laughed. We do have a Mont guide. And a Mont guide is simply a fact sheet that MSU Extension makes available to individuals. And I've got that real long address for it. And it's just simpler. Google Montana Medical Care Savings Accounts and Extension. Montana Medical Care Savings Accounts Extension, it will pop right up because that's the one that you want. And I've revised it so it talks about the 2020 rules, and it'll be just perfect, I think, for giving you additional information. Now, don't forget, if we would happen to have some listeners outside of Gallatin Valley, you can also get that Mont guide at your friendly extension office. And if you're not ready to get out and do that yet, just give me an email. Particularly individuals, you know, a friend that may want one, but she doesn't have a printer, so she can't print stuff out. Or I've even had some people call and say, our book club, could you send enough, could you send 10 for our book club? Sure, we're glad to do that. These are your taxpayer dollars at work. So ask or print out the information that you need. So I'm going to thank you for your participation in this seminar. And what I'd like to do now is ask Emily if you would be kind enough to read me any questions. Do you have questions? And if you don't want to put them in the chat room, what Elizabeth will do, you kind of raise your hand on the right-hand side. There's a thing there for that. And she will let you ask that question.
So at the moment, we don't have any questions in the chat.
Oh, no questions. Well, that's surprising. I would have thought I'd messed something up that everybody would need a clarification on something. So feel free to ask any question that might be of that, something that was a little fuzzy when I was talking about it. And I'll wet my whistle.
Yes. So I just found a couple questions here. How much can Emily contribute to the next year? Up to 4,000 or 4,000 plus the amount rolled over from the prior year?
Yeah, the amount you deposit every year is the 4,000. Okay, so I've been depositing for several years and I've got 16,000 in there. And in the year 2020, I can put in $4,000. And in the year 2021, I can add another 4,000. So you're making deposits, but it keeps in the same account, and we call it, it just rolls over to be used in a future year.
Another question we have, why not use a Roth IRA?
Ah, very good. I got that question just this week when I did it for one of our Tuesday tip sessions. And you could. In this case, I was just thinking traditional rather than the Roth. But you see, if she puts the money in a Roth, she doesn't get the tax deduction now. Okay, because that is only for the traditional retirement accounts. And I think the recommendation now is Roths are the best deal in the world for those that are younger. Those of us that aren't, it depends on what our tax bracket is as to whether or not we want to take it out right now. Because you see, individual retirement accounts started in 1976. So we've got some folks that have, oh my, they have got a lot of money in their IRAs. And not only that, they have rolled over part of their retirement savings into that. And then Congress just surprised the dickens out of us when they passed a law that said now when you leave an IRA to someone, they have to take it out in 10 years. And you see, that was Grandma and Grandpa's way of saying, oh, I'm going to leave my $300,000 IRA to my grandson. My grandson has 70 years left. And that means that grandson would only take out 1/70th every year. Well, now that grandson has to take out 1/10. So there's a lot of folks that are unhappy because it eliminated the stretch IRA, as we used to call it.
Another question. You said that you can't participate after 65, but if you have money left over after 65, can it still be used?
Okay, let me correct that. The health insurance, the HSA, is the one that you can't have after age 65. One of the rules is you have to have a high premium health insurance policy. And if you do, you'll know that. And the other rule is once you turn 65, you can't put any more in. However, you can continue to withdraw from your HSA for any eligible medical expenses. Whereas with the Montana one, at this point, we don't even have a limit. We have a limit of 30,000 on a first-time home buyer account. But on a regular Montana medical care savings account, we've had people open those and add money every year since 1997. Some people have really substantial accounts, but they know our medical expenses increase as we get older. And so they're going to use it for those medical expenses that at that time Medicare won't pay for. And, and it's a legacy if they're not able to use it, which is a good deal for them too. Other questions?
Can those transitioning into retirement still use the MSA?
Yes, yes. That's what I plan to do. I've got one, and it started having more in there than I thought I should have, and just earned 0.2% interest. So what I did is move it into a CD. And I'm not earning a lot there either, but that way I've got a pile of money that I can just grab really quick if I need it. And then I've got the other earning a little bit higher rate of interest. So you can do that. It's a rollover. You're just rolling from the institution to a different tool in the institution. But let me warn you, let's say, like my husband, he decided he didn't like his financial institution anymore. They weren't providing him with what he thought he should have. So he decides that he's going to have that go to another financial institution. And his wife was saying, now, you need to get that done. So he gets it done, and he said, okay, he folded his arms, and he said, here is the deal, wife. I got charged $25 from my institution to roll it over to the other institution, and the other institution charged $25 too. He said, I lost more on that transaction than I was making in interest. And I said, well, you could have left it where you had it. But yeah, I share that story so that you know that, and ask the financial institution, is there a charge? And could that be waived to give it to this other institution? And they may have their rules. What I wish our Department of Revenue would do is to say, Marsha, if you want to take $10,000 out of your MSA, you can do that. And in 60 days, you have to redeposit that. That's what we do with individual retirement accounts. But every time they have their hearings, there's not enough people there to say, you know, you could change this rule and allow us to put it in. Even 30 days would be good, because that would save you those extra fees from your institution as well as the other institution.
So we have Patty here. She had a question. So I'm going to unmute you, Patty, so you can ask your question.
Hi there, Patty.
Hi. I'm not sure what the question was. I had asked several questions via the question and answer thing. The only question that you didn't answer, I guess, was what I've been doing with my medical savings account is at the end of the year, well, I have a medical savings account. I have to keep $200 in it per bank rules. And so at the end of the year, when I know what my medical costs are, but I haven't been separating. Well, I do itemize it, so I could separate it out, medical versus health insurance. I go and deposit the full amount, and then a few days later, draw it all out up to $200. Is that legitimate to do? And then, so right now, sitting in my medical savings account is $200. And next December, I'll go in and do the same thing. However, I didn't realize about the rollover and that the accrual of the money, and that probably would be a good thing to keep doing. I didn't realize that happened. So I don't know, the way I'm doing it, is that reasonable? Is it legitimate?
And the way that, Patty, the way you're doing it is fine. It's just at this stage, if you've got that extra money where you can put it in anyway and know that you're not going to use it. I've got some people doing that. Yeah, they could take it out for their health insurance premiums and stuff, but they're not doing so. My husband's one of those. He's getting teeth replacements, and it's hugely expensive, but he's not using his MSA because he says, I think I'm gonna need it later. So he can do that. And you don't have to.
Mm-hmm.
He's using other savings, but I make him put in the $4,000 every year just in case, so that we'll have that money in our later years.
Okay.
Thanks for the question, Patty.
And thank you for the answer.
Mm-hmm.
Okay, Patty, you're muted again. We have another question here from Dale. So I'm going to unmute you, Dale, and you can ask your question.
Hi there, Dale. I know you too.
Yes, you do know me. My question is, if you use the MSA funds for someone else, do they have to be a Montana resident?
That's an excellent question. We can use it for your children, and they be out of state.
So children, grandchildren could live out of state.
Right. They can't inherit it as an MSA.
I know that.
Okay. So let me, would you Getting? As a matter of fact, I feel like everybody that's listening here should be able to get an email from me where I will get that question answered. Because I don't want to say something that's wrong.
Well, thank you.
So just repeat it so that I make sure that I know what I'm doing here. We want to know if we can use on an out-of-state friend, right? It's not necessarily a relative.
Well, I guess I'd like it just confirmed for all. So if my my children and grandchildren live out of state. I want to make sure I could pay for something for them, but also if a friend who lives out of state, I could use for them.
I know that they can be for your lineal descendants, but I don't know about friend.
Okay.
So I'll get your guys' emails, and so I can send you out the correct information, and I'll learn something at the same time too. Thank you.
Thank you,
Thanks,
Mark. Good program. Thanks very much.
You betcha.
Okay, so I don't see any other questions. Marsha, I tried to put your email address in the chat if you were willing to answer any other questions. So if you are willing to do that, you can put that in the chat for the attendees. If there are no other questions, I'm going to go ahead and end the event. Does anyone have any last minute questions?
Well, if not, I thank you very much again for your participation. And seriously, if you want some of these mock guides to share with your book club, your colleagues at work, you know, we need to get more than 1.2% of Montanans taking advantage of this. I'm afraid the legislature is going to change their mind and say, well, hardly anybody's using it, so why do we have it? Well, that's a thing that can help us save some taxes and for expenses we have anyway. So think about it.
Thank you to Linda Roars for participating. She's with Riverstone Health and Montana Geriatric Education Center. Thank you all for attending. Please take the time to fill out the survey after I end this presentation, and we'll be sending all of the participants an email with the recording. Thank you, Marsha, for participating and presenting this to us, and this was very useful, and that's very prevalent in the comments. So thank you again.
Okay, and can you send me those emails, or you want me to send the answer to you and you send it out?
Yeah, we can.
You could send it out.
Yes.
Okay, that way I don't have theirs, and you know, we keep everything a-okay as far as your promise not to use their emails for some weird thing. So I will find the answer, and Amy, I'll send it to you. Thank you, Elizabeth, for being brave enough to do those polls. You can give me some lessons sometime on how to do them. So thank you, and have a good day.
Thank you, everyone.